Good day, ladies and gentlemen. My name is Dr. Ingky. I'm your digital skin doctor, and for today, I'll be answering your Q&A questions that you have posted in YouTube comments. So, for the first question, hi, can you please suggest for me a skincare for my oily skin? I am a breastfeeding mom? So, now, there are certain skincare ingredients that you cannot use during pregnancy or during breastfeeding. Now, but the good news is, for acne-prone skin, almost all the ingredients in the market, you can definitely use them. Now, for acne-prone skin, what you should look for is you should look for an ingredient, a cleanser that can help melt off excessive sebum in your skin. And the best ingredient is actually salicylic acid. Salicylic acid is a form of beta-hydroxy acid which loves to bind to sebum and it dissolves them so that when you're cleaning your skin, the excessive sebum can auto-exfoliate itself much more quicker and much more naturally. Then the second part is you need to then hydrate your skin. Now, by adding moisturizer, you are actually reducing the amount of sebum that your skin produces because, funnily enough, sebum or lack of sebum actually increases the amount of oil on your skin. So, lack of moisturizer, it triggers a particular feedback mechanism whereby it triggers more sebum production on your skin. And third of all, you actually can use adapalene every night. Now, adapalene or any form of vitamin A derivative is contraindicated, means you cannot use them during pregnancy, but you can definitely use them during breastfeeding. But most importantly, you just need to wash your hands after applying your skincare so that when you come in contact with your baby, they do not get any skin irritation. Next question, syringoma, please advise. So what is actually syringoma? Syringoma is actually enlarged sweat glands. Now they can occur anywhere on your body, especially with sweat glands, but more importantly, we always see syringoma over the face, especially under the eyes. Now, is there any skincare that you can apply to reduce the size of syringoma? Unfortunately, there isn't. No skincare ingredient or product in the market can shrink enlarged sweat glands. Now, the only way to reduce syringomas is to go to a clinic and either get yourself a fractional laser or electrocautery. Now, only with these particular interventions, your syringoma will be able to shrink because heat shrinks syringoma. Now, bear in mind that the syringoma will definitely come back because most syringomas are due to genetics. Right, next question. Hi sir, I'm a kidney patient. Can I use skin actives like vitamin C, niacinamide, retinol, peptides in my daily skincare routine? Now, I'm not sure what kind of kidney patients you are, but I'm thinking that you are a chronic kidney disease patient or what we call CKD, whereby there's impaired kidney function. Now, even though a lot of these skin actives might seem a little bit strong because, it's retinol, it's vitamin A, it's vitamin C. However, most skincare, I would say all skincare that you apply on your skin only is absorbed by your skin and very rarely actually gets into your bloodstream unless you apply too much, very high strength, or there's some form of injury on your skin and blood is exposed, the skincare actives get into the bloodstream. But bear in mind, even though if it gets in, you have many liters of blood in your body and one drop of skincare active that gets in gets diluted and your kidney should be able to get rid of it. So no harm, right? You can use any skincare actives that you want. Right, next question. Now, what's the difference between L-cysteine and NAC? Now, NAC stands for N-acetylcysteine and is roughly the same as L-cysteine. Now, the only difference is it impacts different levels of your hyperpigmentation function. That means that things that creates melanin, L-cysteine and NAC works on different levels. NAC is more active, means that by consuming or by applying NAC, your pigmentation actually reduces much quicker. But L-cysteine, what it does is it is actually a building block for your body to produce its own glutathione, whereby your body would then have sufficient glutathione to reduce the amount of melanin in your skin. So could you opt for either L-cysteine or NAC? Yes, but it actually works best in combination. Okay, hi doc, please suggest a good brand for sensitive skin. There are many sunscreens that can be used for sensitive skin, but personally, this is what I use. I like one of two brands. First is actually the COSRX Invisible Sunscreen. Even though it's a chemical-based sunscreen, it is actually great for people with sensitive and dry skin. I personally use that. Second one is you can always use Alta MD's sunscreen. Right? It's a more physical-based sunscreen. So again, that is good for anyone using sunscreen. Doesn't matter whether you're sensitive skin or not, it works for everyone. All right. Hi, do you know any good physical sunscreen for daily active use with PA3+ or 4+? I dislike most of them because they leave some sort of white cast. Wondering if you've come across any that disappears or is more invisible. Now, a good mineral sunscreen typically contains either titanium dioxide or zinc oxide, and they both leave white cast. Titanium dioxide leaves lesser, but zinc oxide does leave a lot of white cast. Now, there are many brands that have tried to formulate sunscreens that don't leave white cast, and unfortunately, the good ones actually do leave white cast. And what some brands have done is they have tinted the sunscreen. So they've added some sort of coloring to the sunscreen so that the white cast becomes now a brownish cast. Brands like La Roche-Posay actually have very good tinted sunscreen, which are physical sunscreens, but they are also partially chemical sunscreens as well, so we call them hybrid sunscreens. Now, tinted sunscreens are good for people with slightly darker skin tone, and sunscreens do come with different levels of tint, so make sure you go and try out which ones actually work for you. Right, on to the next question. Please help me, how to cure dark, dry, I can say mild eczema eyelids. I'm using non-irritating hydrating eye creams, moisturizer, coconut oil before I go to sleep and face wash. Using mild cleanser, yet nothing is working. What should I do? My beautiful eyes look like weird zombies. Eczema. Now, eczema is caused by dryness of the skin, caused by disruption of the skin barrier because your skin is irritated. And when that happens, typically when there's a little bit of rubbing on your skin, there's trauma in the skin, then there is accumulation of melanin. So there is this dark discoloration on the skin, especially when the trauma has been going on for months and years. And when you have all these things accumulated, it does make the skin look dull and dark, and especially when it's on the eyelids, which is going to be a little bit tricky because the eyelid skin is the thinnest among the entire body. So it means that you cannot apply a lot of actives on your eyelids, otherwise you'll get into the eyes and cause eye irritation. For example, even though we suggest using vitamin C for dark skin or dull skin, you cannot use vitamin C over your eyelids because the vitamin C, which is acidic, will get into your eyes and cause corneal abrasion, injury to your cornea, and that might lead to severe things like loss of vision or even blindness. Now, if it's on the eyes and you want to really lighten it, you can only use, and this is what I can think about, is you can always use niacinamide creams. Niacinamide creams are slightly more neutral based, and even if it accidentally gets into the eyes, you can always wash it off. A thin layer of niacinamide cream. Avoid using serums because serums might get into the eyes. Creams will be able to sit on it. Apply it during the night, especially when you're closing your eyelids at night. All right, so that's my advice to you. All right, next question. Hope this comment finds you well. I just want to ask, what should I do first? If I have a compromised skin barrier and active acne, should I repair my skin barrier first? Or should I repair it and then treat the acne at the same time? This situation happens because of my mistake of over-exfoliating over a year. Now I regret it. So now you have two issues, and they are actually affecting one another. You have active acne, which causes a disruption of the skin barrier. And when you have disrupted skin barrier, bacteria now gets into your skin, making your acne even worse. Now, there is a way to actually solve both of them at the same time. First up is to repair your skin barrier. Now, if acne-prone skin, avoid oily materials like ceramide. But you can always use niacinamide, which naturally triggers your skin to produce its own ceramide. On top of that, avoid using strong actives like salicylic acid, even though they're great for active acne. But because your skin barrier is already disrupted, avoid using salicylic acid. Instead, what I want you to opt for is probably a zinc-based cleanser because zinc actually reduces bacterial activity, and top it up with a niacinamide serum or cream, which will help regulate bacterial activity and sebum production. And because you have active acne, you might need to be started on oral antibiotics or isotretinoin to help reduce your acne much further and disrupting that vicious cycle of damaged skin barrier and active acne. I hope this helps. Right, next question. Hi doctor, I really want to know how to use hyaluronic essence correctly, directly on the face or on the palm first and then rub it on your face. Which method is right to use essence? So essence is slightly more watery based. So it means that the moment you apply, typically, absorption is a little bit quicker. For me, I would prefer it if you apply on your palm first and don't rub it on your palm. Apply on the palm and just rub it directly on the face. Reason why is because if you're putting your essence directly onto the skin, you might accidentally put too much. So by putting on the palm, you'll be able to control the amount of hyaluronic essence that you're actually applying, and make sure your palms are clean, definitely, right? Wash your palms, dry them before you put the essence on your palm. But my suggestion, and this is just a personal preference, put it on your palm and put it on your skin. Okay, next question by Emas. Can we skip toners if we were already using 2% BHA toner twice weekly as an exfoliating process and niacinamide serum once a day? I just use niacinamide vitamin C serum, followed by a lightweight moisturizer and sunscreen at daytime and a barrier serum, retinol or salicylic acid twice a week. Lightweight moisturizer at night is toner compulsory. Toners. The reason why toners have been around for a long time is because toners used to be the only way to get rid of excess makeup and excess sebum from your skin. Because a long time ago, in the 70s and 80s, cleansers were not very good. So it means most cleansers are unable to get into your pores to remove excessive sebum, excessive skin cells, and at the same time remove makeup. That's why toners were important, because they were exfoliating in nature. However, these days, toners are actually optional. You don't actually have to apply toners anymore, especially when you have quite a skincare routine whereby you're already using niacinamide serums, vitamin C serums, and you're using lightweight moisturizers. So my suggestion is, if you think that your skin is doing well without the toners, you could always skip it. But if you like your toners, you can continue. There's no hard and fast rule in skincare. So guys, that's the end of the video. If you want your questions answered, let me know in the comments below, and I'll make another video to respond to your questions with the proper way on how to look after your skin and how to bust myth. If you like this particular video, I would like to like, subscribe, and comment below. And at the same time, let me know what kind of videos you want me to make next. Right, that's it from me. I'm Dr. Ingky, your digital skin doctor. And always remember to stay safe, stay healthy, and most importantly, stay informed.